part of that meetings which are happening in DPIT. They are actually thinking about how to make this medical hub more profitable for everyone, not only for the hospital person, but rather same time with the hotels, our corridors, everything. So I am having with me lots of good people. I am working day to day with all these people. Navneet is sitting with me, who is, I think, pioneer in this field, who started because Apollo and Medanta and Dalip is here, who is actually trying to make this place more streamlined with all SCF, has to be accredited, has to be regularized. And Viji is sitting here with me. Manipal is also doing great job. And then Mr. Mihir Vora. So now I am trying to create that atmosphere that everybody can speak and they can take their time. I will start with Navneet because he is in hurry. He has to go. But Navneet, you cannot leave my panel. When I will leave, only then you can leave. So now, over to you.
Thank you, ma'am. Thank you very much for the kind words. Like in any way, but I can assure you one thing. I represent Medanta and most of the hospitals in India, even Manipal for that matter, ma'am's hospital, we are not late in giving treatments to our patients. That way, we are very particular. Everything happens in time, and we all work with a common goal that the patient goes back on his feet and with a smile. Because every satisfied patient ultimately becomes our brand ambassador in their respective country, in their respective homes. Now, as far as the medical value travel goes, we have a very elite panel, as ma'am rightly said. Ma'am herself has always been supporting growth of medical value travel, always being supportive of promoting India, not only her own hospital, but promoting India as the most preferred medical value destination. India offers the world-class quality care at affordable cost. We are cheaper than our competitors, whether USA, Turkey, Singapore, Malaysia, China, anywhere. The best part of Indian healthcare is we have the best doctors available anywhere in the world. Even if you pick up US, I'm sure you're all aware, it is dominated, US healthcare is dominated by a lot of Indian doctors. Europe is dominated by Indian doctors. So we have the quality care already available. Our nursing staff is world class. Our training schedules are world class. So, and the backup medical team, whether it is technicians or patient care services, we are world class. At least most of the leading hospitals in India, whether they are in North India, Hyderabad, Bangalore or down south Kerala, they are all world class. And Kerala, of course, leads India with the alternate medicine. They have the time-tested, proven Ayurveda, which adds to India's MBT program. So I would not like to take too much of time. We are growing. We'll keep growing. Indian healthcare is today definitely is one of the best in Asia Pacific region. Europe also, we are much ahead. The size of hospitals, the volume that we do, that is what makes us world class. And I'm sure in the times to come we'll surpass the US standards by any chance. At every cost we will cross it because we have the potential and we will do it. That is for sure. And ma'am, that's it. Thank you.
So now I think Dalip is sitting next to me. Dalip, you can tell your point of view how you want to make those people who are actually working as a MBT players and who are basically backbone of this business, because they are opening their offices in different countries and they are taking patients from there. So please tell me what is your point of view, how we can make more strengthen and how we can compete with this Thailand and all, because we are the one who is having basically they are doing only few things and we are into all things, and very serious patients are coming and getting totally fit back to their countries. So please tell me.
Thank you, Upasana Madam, for giving me an opportunity to speak on this, what you call as the role of medical value travel facilitators and building up the medical value travel industry of India. So, Basically, it is Heal in India, bringing patients to India for medical treatment. And as you know, India is known as the country as a country with doctors who are saving lives. That is, that whenever a person in any of the country who doesn't have the treatment and it's a life-threatening disease, he looks towards India. Because India is treating life-threatening diseases in the most excellent way. Namely, oncology, that is cancer treatment. Namely, any organ transplant. We are also known as the transplant country of the world. The way we are also known as pharmacy of the world, we are also known as transplant country of the world. You name an organ, we do transplant in India, whether it is kidney, liver, heart, lung, intestine, pancreas, limb. So you name an organ, we do the transplant in India, and that too in the most successful way. Now this happens only when there are two what you call as the wheels in this particular business. One is known as medical value travel facilitator and another is known as the hospital. If they go hand in hand with each other, the journey is very safe and smooth. We have more than 10,000 medical value travel facilitators in India, which includes individual facilitators as well. And we have, out of that, there are only 21 medical travel facilitator companies who are NABH accredited. So these NABH accredited companies, I think, Meher, you were the first one. Meher's company was the first one who was NABH accredited. And I think it is from last 5 to 7 years, 8 years. But practically, NABH has not given anything to what you call as the medical value travel facilitators. There is no benefit given to what you call as the medical value travel facilitators being accredited by NABH. So there is a lot of things has to be done from NABH or from government side. All these medical value travel facilitators are very strong in their own area of operation. Every facilitator, I can name certain facilitators also, those who are very strong in their own geographies, So bringing the what you call as the help given to these facilitators by hospitals, as well as hospitals are already helping them, The help being given by the government. Earlier there was there was Marketing Assistance Development Fund, which was given by Tourism Ministry. Now it is being withdrawn. Nothing has been given to do marketing of India out of India. Whereas Turkey gives a lot of subsidy to their medical value travel facilitators as well as the hospitals when they do anything out of their own country. We need a lot of help and support from the government in terms of what you call as the fund for creating awareness, more awareness in the source countries to bring patients to India. So that is what is required, and I think where we are lacking. Hospitals already are doing a lot of coordination with the facilitators, but there is a lack from what you call as the hospital, from the government side. Plus, wherever we do outreach program out of India, we go as an individual entity. There is no India pavilion. There is no medical tourism of India like that. Everybody opens his own shop separately in the what you call as event out of India in the source countries. So there we need the funds to be given by the government to project India as one entity. And moreover, me being the representative of Foundation of Healthcare and Wellness Promotion, we are representing hospitals as well as the medical value travel facilitators. The funds should be given to our association so that there is no wastage of funds. The fund is utilized for the industry and by the industry. This is what I wanted to say. Thank you.
Thank you, Dalip. But because I am wearing many hats, like I am working as a hospital provider, I am sitting here as a SEPC chairperson, and I really wanted to crack this news in front of all of you that we are going to launch our new portal, which is all the data we have taken from the government of India. Now we are going to launch in the next month, June, last week of June, where we will do this also, and then NABH, importance of NABH will come. We are going to put only those hospitals who are accredited as well as only those facilitators who are accredited on that portal, and that portal will be available in all missions in different countries, all missions of India in different countries. So then there will be a clear picture of Indian healthcare system to those who are coming from different country to India. They will be aware that if they are going to this hospital, all data will be available with the name of doctor, his education, his experiences, how many surgeries he has performed, what is the cost of the surgery, what is his outcome, and outcome we are going to send to NABH, and NABH is going to publish outcome of that hospital. So it will be clear picture of that hospital. It should not be like this, anybody can take patient to any hospital. So it is going to be streamlined within 2 months, and then you can, now it's your turn. But same time I am telling you, when government is ready to do something now, then things happens. Now government has taken this initiative. Before that we were going to them and asking lots of things. Now they are asking from us, what do you want? And I am telling them that it is really need of our that not only foreign ministry, not only health ministry, we need to tie up with aviation ministry also to get more connectivity, because there are many, like Kazakhstan, so many patients are coming, but there is hardly any flights. So we are asking them and things will take shape. Yeah.
Madam, being you are the chair of SEPC, I'll take an example of SEPC. SEPC organizes Sanjeevani every year, and hopefully in Bharat Health they will be doing Sanjeevani. Madam, for medical value travel industry, there is no need of organizing an exhibition. We should organize the fund which is being given to any organization, whether it is SEPC or FICCI or CIA or PhD Chamber of Commerce. It should be utilized for seeing and believing. Their trip should be organized to hospitals where they are going to send the patients. It should be a med-well trip, not an exhibition. We are wasting our funds for organizing an exhibition, madam. So, if we are inviting 200 or you can say 300 or 100, you can say the foreign delegates, they should visit hospitals. They should not waste their time in exhibitions, because exhibition you cannot show, suppose the what you call as the operation theaters, you cannot get them meet the doctors who are treating. So once they meet the what you call as the doctors, they see your infrastructure, they see your nursing programs, until or unless they see what is there in the hospital, they will get a lot of belief in that. Whereas what happens normally, we organize 3 days event, 2.5 days we made them sit in an exhibition center, half day we keep it for hospital visit, and which is done awfully, which is done arranged awfully, I am saying that. They will not get time to visit the hospitals, it is just a eyewash. This is what my submission is, madam. Okay, so that fund should be utilized by the industry for the industry. That is what my submission is. Thank you, madam.
So Viji, because you are dealing with patients, so what is your point of view that what exactly a hospital want, that how he can improve his medical value travel, where there are lots of problems between SCFs and hospitals also. Sometimes they start asking something else which is not in their MOU, that you have to do this also, you have to do that also. Like these days it's a fashion that SCFs are asking that my patient, we are providing vehicle to patient and attendant, but now they want their staff has to get some vehicle. So how you are facing this problem and how you are solving this problem?
Okay. Good morning all, and thank you, ma'am, and thank you for giving this opportunity to be part of this esteemed panelists. So as a private hospital, we have, during these discussions, we have heard that how India's health sector is expanding and how this medical value travel as a vertical has grown over these years. And it is estimated to be $13 billion business for this year. If we just go by the estimate, that is the kind of economic impact that is having just by having patients coming from outside India for treatment to this country. And being a private hospital, of course, all the private hospitals have, I would say, started this revolution of getting more and more patients to our country. And now it is very heartening to note that Government of India has also started taking steps like this Heal in India program. So, but ma'am, as you rightly said, as an individual, like a hospital, we are also trying to get our pie. And we are trying to put a lot of systems in place, an ecosystem in place where we are able to fetch patients from outside, and mainly through facilitators. We are still aggregators and facilitators are our major partners from where we are getting patients. And I'm sure every private hospital is operating and trying to work with you, partnering with facilitators to get more and more patients. When the patient come to our hospital, what we are seeing is, as rightly pointed out by various speakers, Mugdha ma'am, and like you have pointed out, it's not an individual, a standalone, ecosystem where the private hospital and the patient and the facilitator works together. It requires a very, very broad kind of, what ma'am has been trying to talk about, an inclusive and integrated approach, where the various players come together so that the patient is taken care of well. It's not just the hospital, inside the hospital, it is also about the partners whom we are working with, the logistics, the travel and tourism industry, which is actually bringing the patients, and also being able to provide all these services within a very ethical and a regulatory framework. But now we do not have this, in India, I'm happy to note that some efforts have been going on to get into an integrated approach where various individual players come together as a common, entity, and we are able to provide these services in a much more effective manner. One point, ma'am, I would just like to talk about is, see, we all know that treatment in India is much more affordable. That's the reason that people are coming here. Like I was just reading that, a Viji surgery is around 66% lower cost in India compared to any of the other major destinations like US or Australia or even Singapore or, Asian countries like Thailand. So India has that potential, but we do not have a uniform pricing system. So even today, individual hospitals, like my hospital, we are having a kind of a pricing policy or what kind of packages we are developing. There is no uniformity. Now this leads to a little bit of internal competition within our hospitals, whereas another hospital is willing to give this, so facilitator would like to move the patient where they are getting maybe a lesser package. So somewhere while we are working towards getting an integrated approach, these kind of aspects like a uniform pricing for certain services, where all the hospitals come together and try and develop framework where we work on this. And very heartening to note that in MBH empanelment of facilitators are happening. That will bring in a lot of quality of care to the patients, ultimately, patient centricity. So these are some of the thoughts I wanted to share, and very happy to know that to have this kind of discussions where multiple stakeholders are coming together and doing a brainstorming on how do we bring in and how do we develop this vertical and get India more and more, India's economy will improve, and this medical value travel as such, how can it bring more and more foreign funding to our country? And also, India is viewed as a global healthcare provider. So that is what we wish for. And thank you so much.
Thank you so much, Viji. And what I feel that we should think about brand Bharat. Until unless we will showcase as a brand Bharat, we will hardly get to, because when somebody talk about Thailand, they talk about Thailand. They don't talk about some hospital in Thailand. But right now, everybody is talking about particular hospitals. We need to remove that. We need to project everybody. Not only one person can do anything. We need to project brand Bharat. So now I will move to Mihirji. Mihirji, unfortunately, it's our first meeting, so I don't know much about you. So you can present your point of view as a facilitators. What kind of improvement you want from government and from hospitals?
So first of all, thank you HPIE for inviting me for the panel and sitting with the fellow seniors here. As ma'am said, we are meeting for the first time. So I'm Mihir. I'm a founder and group CEO for Magnus Medi and Simplify MVT, where Magnus is a tech company, a service company. Simplify is a tech company, which is pure B2B in medical travel. So we have office in 10 countries and we work with various partners to get and manage their patients in India. I would also want to thank our doctors, our hospitals to create infrastructure which we are able to promote in outside India, which is how the industry exists. Now coming back to the various discussions that my fellow senior did. One, yes, we are affordable, but what always we do is we tell about medical value travel, but the value that we ourselves perceive is only related to cost. Unfortunately, we are not giving them the service. We are not giving them the experience. If we go to Arora or Taj, we actually don't worry about their prices. We are worried about their experience, So when people go to Thailand, they are paying 3x, 4x than our price. The only reason is their overall experience. I'm too young to you people, but 35 years ago, our people used to go to Thailand, UK for bypass, right? And people were worried only about doctor's time and clinical outcome, not the services. Today, it is 50-50. So how much doctor is giving time, what is the cost, what is your treatment outcome. At the same time, the rest 50 is how you are giving services. So how you are perceiving. Even today, we are getting from poor countries. Maximum patient that we are getting is from poor countries. So if I talk about positioning, we need to promote ourselves as we are best clinical outcome destination, yet affordable. So that is what we should promote. We should position ourselves. Today we are not getting great patients from UK, Europe, US, which is where we are not getting into number one destination. And I don't think anything can stop us if we provide experience to them. And like I'm sitting Yashoda Medicity, I have seen, there are hospitals that is coming out of tier 2, tier 3 cities as well, which are great in infrastructure. I do work with a hospital called NCI in Nagpur. Beautiful, 470 bed cancer hospital. So there are a lot of such hospitals. Manipal is doing fab work in Siliguri. So yeah, so we've got great hospitals around India. We're limited ourselves to Delhi. If we look at Kerala, they are doing fantastic job. So my perception is how can we give experience to the patient and how can we position ourselves as best clinical destination yet affordable.
Thank you. Bolo, please.
Just adding on to what Mihir was saying, basically we all have been, our seasoned players, we have been attending meetings with all the ministries trying to promote Indian medical value travel. As Mihir and ma'am rightly said, जो हम लोग को चाहिए वो अब बाकी का काम गवर्नमेंट के साथ मिलकर ही होगा, क्योंकि हमें इंडिविजुअली मेदांता इज़ वेरी गुड, मणिपाल इज़ डूइंग गुड, यशोदा इज़ द बेस्ट न्यू हॉस्पिटल एंड इट इज़ ऑलरेडी डूइंग वेरी वेल. Number of beds have increased. Private players have come in which are providing world class healthcare already. हम अफोर्डेबल हैं, इसके बारे में भी कोई डाउट नहीं है. अभी प्रॉब्लम क्या है कि अगर अपने को थाईलैंड से या मलेशिया से कॉम्पीट करना है तो हमें गवर्नमेंट की हेल्प से ही ब्रांड इंडिया हेल्थ केयर को इकट्ठे होके प्रमोट करना है बाहर, इकट्ठे होके. उसमें आई बेग टू डिफर विद विजी दैट एक यूनिफॉर्म प्राइसिंग, हमारा देश बहुत बड़ा है, इंडिया इज़ अ वेरी बिग हॉस्पिटल, द कॉस्ट चेंजेस एज यू ट्रैवल डाउन द कंट्री, द कॉस्ट ऑफ मैन पावर, द कॉस्ट ऑफ मेंटेनेंस कॉस्ट एंड एवरीथिंग चेंजेस. तो एक यूनिफॉर्म प्राइस तो नहीं आ सकता, बट येस वी कैन वर्क टुवर्ड द यूनिफाइड फार्मूला टू प्रोजेक्ट इंडिया. वी आर द बेस्ट, वी नीड टू बी प्रमोटेड. एंड इसमें हमें मैम ने जैसे बोला एविएशन इंडस्ट्री का बहुत बड़ा रोल है. They have to listen to us. They have to call close meeting, ma'am, which only you can organize. We all can be there. Ministry of Civil Aviation के साथ, Ministry of Tourism के साथ, and Ministry of Industry के साथ, where we all come together. देखें भाई किस किस कंट्री से पेशेंट आते हैं और जो नहीं आ पा रहे बिकॉज कनेक्शन नहीं है. You know, they spend so many. अब जैसे तुर्कमेनिस्तान है, किर्गिस्तान है, they are dependent on India for treatment. लेकिन फ्लाइट्स नहीं है. So, as Mihir, you rightly said, we have to come together to in a unified manner. और मैम आपसे रिक्वेस्ट है कि आप गवर्नमेंट से थोड़ा बात करें सबके बिहाफ पे, since you are on every side, you should take it forward and we should promote India. 6 महीने हो जाते हैं एक मीटिंग को कि आगे कुछ होता ही नहीं. तो अगर हम वो करेंगे तो I think we can do very well.
So I just wanted to correct this news that now PMO has given this direction to Quality Council of India that they have to take care of medical value travel with SEPC, FHWP and what all stakeholders. So there is a committee also formed and lots of people are working with that. So now they will talk to everyone and we are going to project ourselves as a Vasudhaiv Kutumbakam and brand Bharat. And now there is a grading system also coming in NABH accredited hospital. So those who are dealing with medical value travel, they should have that grading A grade or A++. So we are going to resolve all these problems and thank you very much for all panelists. Time constraint is there and I want to keep everything on time. Thank you and those who are listening to us.
If anyone having question, please.
No, I don't have a question. I'll just make a short comment. I chair a working group set up by Ministry of Ayush. Our mandate was to identify Ayush products and services which meet global standards. The program was launched by the Prime Minister in December 2025. And one of the service or two of the services we identified were wellness and medical value travel. Unfortunately, there was no structured accreditation or certification system meeting global standards. We identified global standards as well, but the NABH system, unfortunately, even the Ayush hospital standard does not meet global standards. That was the unfortunate part. So now, Madam knows, in SEPC itself, now there's an initiative to launch a wellness center certification program based on ISO standard and a MVTF certification program based on ISO standard. That ISO standard is 22525. The drafts standard as well as criteria as well as certification system has been placed on SEPC website recently, just this week. So I would encourage you all to look at that because there's going to be at least one structured system as per international standards available. Hopefully next month it should be ready. After a month of public comments, we should be able to finalize it and hopefully it will be available to all of you. Thank you.
Ma'am, I represent Viksit Consulting, one of the units which is promoting a lot of healthcare, a lot of strategy inputs behind the show. We've been talking to many hospitals and acquiring a lot of manpower for certain things. We see a major gap in terms of the insurance operators of other countries which provide the healthcare part and the Indian context with respect to EHR, EMR and certain things to be integrated in such a level where these things can be promoted on a larger scales. I understand limitation of flights, aviation is one part of the story because which reduces another cost part of it. But the another reason which we see is if government can initiate a partnership with the insurance operators of other countries to bring in some people from other side to this part and bring a value on the table, sir.
No, this is a very valid point and this has already been taken up at very high level. इसमें Commerce Ministry भी involved है. We were all there in that meeting. We have already raised this point collectively कि international insurance companies should come in here and they should be encouraged to open their own offices here, at least small office, regional office, Asia Pacific के लिए. Once that thing happens, it will definitely encourage a lot of patients to travel freely. Yes. So, जैसे domestic insurance है, we are trying to encourage international partners to come to us.
Thank you so much everyone for giving such a good audience and for giving such an insightful conversation, ma'am and sirs. Now may I request Afzal sir to please come up on the stage to felicitate all the esteemed speakers who have given and delivered a wonderful conversation on medical value travel.